I just wanted to say thank you for inviting me down to talk today to start off with. And before I kind of move on any further, I just want to say thank you for Deborah for inviting me down specifically. And if we can get a round of applause for Deborah and the team for organising. So, like Deborah said, some of you may know me, some of you may not have seen me before. I am a PhD academic and research assistant at the Wolfson Palliative Care Research Centre up at Hull. I'm not from Hull originally, I'm from Newcastle. So I'm kind of an imposter at the university, unfortunately. But what we'll do is we'll go through the presentation overview. So I'll talk a bit about me at the start, just as any academic does. I'm going to go over a bit of the history of exercise oncology, discuss physical activity and exercise and what they actually mean within oncology, some information about becoming more physically active and what that actually means, because there's some misconceptions behind that. What happens inside the body in relation to exercise? Some new information around bone metastases. I did forget to put on there the information about brain mets, so if I forget to mention that at this section, someone please remind me. And then we're going to discuss some of my latest work. So, I didn't realize how big that picture was going to be. So my background is in clinical exercise physiology. I've worked in the health and fitness industry for a number of years, from jobs such as personal trainers up until educating personal trainers. I do doctoral research, and a lot of my research focuses specifically on lung cancer. So that's everything from non-small cell to small cell, to even cancers affecting the lung like pleural mesothelioma. I work on a number of projects using exercise and physical activity, and I also teach exercise physiology, exercise medicine, and research methodology, which I won't be discussing today because it'll send you to sleep. So what is exercise oncology and where did it really come from? So we can see down here, the earliest documentation of a tumor, a bulging tumor, dates back to around 3000 BCE, so quite some time ago. And in 600 BC, we had the first documentation of anyone prescribing exercise for a health-related reason. So that's quite a while ago. However, it was only really in 1952 that we started looking at exercise in relation to cancer, not 1952, 1953, in exercise within cancer. So that's not too long ago, really. And again, we're jumping up some time now. In 1966, there was only 11 real studies that explored physical activity within cancer. So again, not that many studies really, and that isn't too long ago. And as you can see, I wasn't as tall as Tom, but in 2005 was when the field of exercise oncology was actually first named. So it was not that long ago really. In 2010, 2019, there was 2 sets of exercise guidelines. So again, only in the last kind of couple of years, really the last decade, where we've actually put out some guidelines for individuals to help them exercise. So what is physical activity? This may seem like a silly question. However, physical activity and exercise are often used interchangeably, and they are actually very different. I was going to ask you what they mean, but I put that on the slides. So physical activity is any bodily movement above rest. So I'm up here now, standing, move my arms. I'm being physically active. I'm not exercising. The difference is exercise is regarded as planned, pre-structured, and repetitive bodily movements with the goal of maintaining or improving physical fitness. Sorry, that's a mouthful. So if I was to ask you to stand up now, I won't do it. If I was to ask you to stand up now and go and get a cup of coffee, you'd be being physically active, but odds are you're probably not exercising unless your goal is to go and do a few laps with the coffee. So just early off, I wanted to kind of set the tone and say these are different things. People use them synonymously and very interchangeably, but they are different. You may have heard me say that physical fitness. What physical fitness is two sets of attributes. The skills are things like balance, agility, reaction time, speed, and health is things like your body composition, your flexibility, your strength. That is what we aim to improve or maintain by exercise, not being physically active. So, the thing that everyone wants to know about is within cancer. So, like I mentioned, the guidelines are relatively new. They were updated in 2019. And the guidelines, so I made this poster, so if you don't like it. So, aerobic exercise, what is it to start with? So, aerobic exercise is exercise that involves using the lungs, the heart, to really kind of rely on the oxygen that we take. So, things like walking, running, swimming, cycling. What they recommend is that we get 150 to 300 minutes of moderate exercise or 75 to 100 minutes vigorous exercise. Resistance training, they recommend we do that 2 days a week. So resistance training is things like lifting weights, anything that really puts a stress onto the body. And they also recommend to do some stretching when possible of major muscle groups. But what I'm going to kind of discuss now is really, what does moderate and vigorous mean? Does anyone have any ideas what that might mean? Just raise your hand. No? Fantastic. Heart rate, so that's something that we include. The actual definition is a little bit more complicated. So we use what we call metabolic equivalent of tasks. So the reason I want to discuss this is because when you look at it, it's a bit confusing. So 1 MET is sitting quietly. So like everyone is doing now, that would be classified as 1 MET. 4 MET is just 4 times you sitting quietly, the effort it takes. It's not super scientific. But to be moderately active, we recommend that you perform around 3 to 5.9 METs. To be vigorous, we recommend you perform at 6 METs. What does that mean? What I recommend is if you're performing moderately, you are walking at a brisk pace. You can hold a light conversation or even sing. Who was singing on their walk? I've got no idea. And if they are, I'm crossing the road. However, you shouldn't be able to hold an in-depth conversation performing moderate activity. Now, if we jump over to vigorous, what does this mean? You can't hold a light conversation or sing. You are working at a much harder intensity. Your things like running, swimming. I put garden on here because when I garden, I get absolutely knackered. Football or carrying heavy weights. So that's what I mean, just to contextualize what all this means. What does this mean? These are the examples that I'm going to be that I kind of refer to. So, some of the impacts, symptom burdens of cancer as a whole. We've got fatigue, probably one of the most common ones. Mood, breathlessness, also known as dyspnea, pain, restless sleep, and the list can go on. In green, we've got some benefits, improvements of physical activity. What can it do? And if I've done it right, you can now see that as we go across, you can see a symptom or burden of cancer is fatigue. Exercise has been shown by the evidence to reduce fatigue. Again, depression, anxiety, low mood, exercise has been shown to improve mood. Everyone who has exercised in this room probably at very first didn't like it, but after the fact you probably felt quite good. And it improves breathlessness, it can reduce pain levels, it can improve sleep, immune function, bone density, which is important, which we'll come on to later, the muscle size and strength, and it can reduce chemo brain. It also has been shown in targeted drug therapies to induce to reduce the level of forgetfulness and kind of that brain fog you might feel. It does this through some neurological developments, which we'll discuss. Hopefully some reminds me of the brain mets. Again, I made this lovely little picture, and I think it kind of contextualized an overall benefit ratio of what impact physical activity can have. And this was from a specific lung cancer paper. So we can see, again, some of the most important ones. Fatigue can be decreased. Muscle strength and muscle mass can increase. The strength of your respiratory muscles so you can breathe more efficiently. It can help improve sleep quality, reduce anxiety, depression. And over here, we can see some immune function. So it can actually boost your immune system, which is really important, especially during the times that we've been living for the last 2 years. So, how can we become more physically active? Walking. A lot of people have this conception that to be physically active and exercise, you need to go to a gym, lift heavy weights, do star jumps, do cartwheels. It's not true. I can't and never will do a cartwheel. So, go at your own pace. You don't need to walk at a really high intensity, walk up a mountain. You don't need to do it. Go to the shop, go to the post office. I have individuals that when they go make a cup of tea, they get up and walk to their front door as many times as they can while the kettle's boiling. And they say how many times they can do it. It's an absolute nightmare if you've got one of them fast boiling kettles. Do it with a buddy, have a walk and talk, make it a social activity. And walking is associated with a number of benefits, such as it can calm you down. If you walk by the sea, people anecdotally say it knocks them out and puts them to sleep. I've got one written down here. It helps breathing. It can help work a lot of range of muscles. I don't know who's walking like this, but if you do, you're getting some arm movement as well. One of my favorite exercises, if anyone's worked with me before, they'll have done this exercise more than likely. It's called a sit to stand. It's an exercise that can be done at home. You don't need to go to the gym. One of the best things is it builds on the legs, the core, and the back. If anyone has a think just currently, what kind of motions in a day that someone would be using these kind of muscles, how often do you think you use them? I haven't got a number, I'm just wondering. If anyone's got any ideas, just have a think. So, how often we use them is really, it's quite often. We get out of the chairs, we get out of bed. If you sit on the toilet, you've got to get back up. Walking up and down stairs, you've got stairs in your house. There's quite a lot, even kind of pushing the pedals in the car. These muscles work a lot. And I have two top tips for doing this exercise. One is a more serious one than the other, but don't pick a low down chair, because if you're squatting down really low, you've got a lot greater range of movement to push, which can damage, and it's really hard to keep a flat back. The second is don't pick a comfy chair, because you won't want to get out of it. Calf raises. So, another really good exercise to do at home. These aren't very intense exercises, however, they have a lot of benefits. Ankles are a critical part of our ability to walk. If we jump back 2 slides, walking is a great exercise. But it can also help our balance significantly. So, people who don't have a great level of balance, they tend to be a bit wobbly on their ankles. Training the ankles can really help stabilize our legs, which then helps stabilize the rest of us. It helps improve blood flow and circulation. So if you think the heart at the top here, all the blood that's coming down here, how does it get back at the top? We have a system called venous return. It helps pump the blood back up. It helps increase that level of blood flow and circulation so oxygen can get to other working muscles. Like I mentioned, balance. It can prevent injuries. It can be done at home, and it can be modified to sitting down. So for those who don't want to stand up, have balance issues, or are a bit nervous, you can change it to be sat down. A lot of my work, we change exercises to be sat down just to start off with to help people progress. So going a little bit harder, bicep curls, using resistance bands. It's a great progression to use resistance bands. And if you think about what kind of benefits that have, is it improves specifically bicep curls, grip strength, so picking things off shelves, picking things up, carrying shopping. I'm the kind of person that won't do 3 trips to the car, I'll do it 1 and I'll carry everything. Elbow flexion. So again, picking things up, moving things, and like I said, lifting things, they kind of all mean the same thing. You don't need the resistance band to do it though. If you don't have them, you can use bottles of soup, water, you can get the big squash bottles filled up with water. I've seen people fill them up with sand before. I don't recommend taking sand from the beach though. So you can do loads of things. And these are only the very tip of the exercises that I tend to start prescribing. So, this lovely picture, again, if you worked with me before, you'll have definitely seen this because I use it all the time. There's a fancy term in exercise called auto-regulation, and we're starting to use this more and more. And what that means is, I ask you, as an exercise professional, how you feel. I tend to get people to work between 50 and 80% of their effort capacity. So I say, okay, we're going to do a bicep curl now. I want you to work at your perceived level of a 6. And the reason I do that is because my 6 is different to your 6, and the person next to you 6 is different to their person's 6. And also, you have really bad days during treatment. It's not always sunshine. So if you're not feeling great, your one day 6 changes to a different day. So there's evidence to say that no matter if you change this, if you manipulate this threshold, you're still gaining benefits. And that's really important because I never recommend people to really push themselves over the top, because if you're pushing so hard at one point, you're not going to really enjoy the exercise you're doing. And that's really important, is to keep that level of enjoyment. And we can manipulate these training variables known as duration, intensity, and volume, and that's how we get progression. So you've probably seen before, you start off doing 2 times 12 reps, and eventually you'll jump up to maybe 3 times 12. So you don't stay stagnant, you kind of increase it as you go. This is where I lose half the audience normally. So what I'm going to do is ask everyone, if you can, to do a sit to stand 3 times. If you can't, if you've got bone mets in your hips or thighs, I recommend not doing this, but ultimately have a read the instructions. So you sit down, I haven't got a chair, but you sit down and do it 3 times in a row at a slow pace. Don't rush yourself. If you need to balance, hold the table. Only 3. You can do 12 if you want, that's fine. So the reason I got you to do 3 is just to kind of feel what muscles work and how common you use their muscles. They're not just the basic muscles. And the reason that I kind of have this information on the screen is just so you can see. When you perform the exercise, by a show of hands, who done this last point here, the inhale and exhale? Did anyone do that? Great, great, fantastic. So when we do the hard part of an exercise, we tend to exhale. And on the lighter part, we inhale. So as we're doing I haven't got a chair, but this might be embarrassing. So as we stand up, we breathe out, because that kind of helps us push through the exercise. And whilst you're going back down, we breathe back in. We regulate our movements through our breath. That's a really good way. Don't hold your breath. That's a really common technique that people adopt, to hold their breath. They think it helps, but it can have negative side effects. So what's happening inside the body? This is something that's hypothesized. It's not kind of really set in stone, but it's really interesting that we have a chronological age and a biological age. And as you can see, typically our chronological age increases with our biological age. Makes sense? At the point of a cancer diagnosis and treatment starts, you can start to see this blue line starts to veer off, and our biological age gets quicker than our chronological age. There's some reasons for this. So in the body, cells start to die, not just cancer cells, but other cells. Stem cell exhaustion, so stem cells don't have the same ability to adapt at the same rate. We start to lose cell power, and our DNA of cells starts becoming damaged because of the treatments sometimes and the cancer. And what this translates to is our functional capacity over our chronological age should be a pretty steady decrease. But once we start treatment and get diagnosed, this can start taking a sharp decline. So again, our chronological age, our functional capacity should start dipping around, well, start really declining around here. That should be where we're starting to feel it. But it's starting to get around here. And the reason I highlight that is because exercise can help mitigate them factors, it can help reduce them. And we can start to increase our functional capacity. So the higher we start off, the less space we have to fall. Something really pertinent for a lot of people in this group will be bone mets. And just to describe what a bone met is, if someone doesn't know, cancer that spreads to the bone, there's 2 main types. Osteolytic, which is a destruction of bone. So the bone breaks down and becomes weak. And osteoblastic, which is the deposition of new bone. So new bone gets formed without old bone being destroyed. So bones don't just stay as they are, they kind of get destroyed and rebuilt. In osteoblastic bones, some people have said to me, well, isn't it better to have more bone? No, bones become very stiff and tense, which means if you place a load on them, they'll snap. And some people have both. So they've got some osteolytic, some osteoblastic. In research, it also says osteoblastic known as sclerotic. Spinal cord compression, so cancer can start growing into the spine and press on the spinal cord itself, causing neck pain and back pain and some other issues. Early symptoms, like I mentioned, is back pain, numbness in the legs and belly. So when you get numbness in the legs, it can be very dangerous to do things like a sit to stand. You can get weakness, so again, getting out of bed, getting out of the chair can become a lot harder. And you can start losing control of your urine stool, those incontinence. So this is all because of this tumor pressing into the spinal cord, essentially. Are bone mets common? So I mentioned it's quite pertinent to this group. So Panatel found that in ALK-ROS1, bone metastases were accounting in 43% of patients that were a large sample. Sclerotic, so like I said before, osteoblastic, makes up around 20% versus 7% of EGFR tumors in this population. So it's quite an important thing to discuss and consider when prescribing exercise. So For those who have high risk of fractures, you don't get out of exercise so easy. There are exercises that we can do. And if you look here, all the spines are in fairly neutral positions. They're quite secure. We're still exercising parts of the bodies, but the spine is in a nice, safe position. And when we have bone meds, in any exercise to be honest, but specifically bone meds, there is a real focus on form. And we need to be in a safe and secure form. And what I mean by that is there shouldn't be no real heavy twisting. So if you've got spinal meds, you don't want to be seeing yourself doing that. If you've got bone meds in the arm, you don't want to be seeing quick extensions because that quick movement can put a high stress that your body's not prepared for. So some new evidence. Up until not too long ago, clinicians and patients with bone meds were kind of very apprehensive about doing exercise in fear that it would place stress on the bones and cause fractures. Very justified fear. However, new evidence has came out of around 17 studies with around, I think, where have I written down, around 1,500 patients to say that exercise appears to be safe for individuals with bone meds. The review found mixed efficacy. This is because there's different types of exercises prescribed, home-based, online, mixed. So there needs to be a stronger kind of codification of how I prescribe an exercise. And the majority of trials included an element of supervised exercise, like I said. And that's really important because I always recommend patients, if they've got bone meds, unstable bone meds, to go and speak to someone who's a physiologist. But as a physiologist, I also like to speak to your clinician to say, look, where's this bone met? How big is it? Is it in a dangerous location? If it's in the hip, I might not prescribe running, I might prescribe cycling. So these are things that I need to know. So again, we always recommend speaking to an exercise physiologist or your clinician or physiotherapist. However, it is safe. We've shown it's safe in early evidence. Brain meds. So brain meds are again quite common. And exercise has been shown to, in healthy populations and not in disease populations, to increase the level of nerve tissue development. So the more we exercise, our brain actually can create new tissue. This is called neurogenesis. The brain has a load of hormones that can help its structure and development in addition to the neurogenesis. Exercise has been shown to increase the level of hormones and growth factors, which is really good. And that's all I wrote down. So again, exercise is great all around. I mean, I'm going to preach that for a long time. In my evidence, what am I finding? So I specialize as well in online care, so doing things like Zoom and Apple Watches and Fitbits, all them fun things. There isn't much out there for those with lung cancer for online supportive care, which is quite concerning, especially through the pandemic when everything went digital. Although we found that exercise may be feasible and acceptable, the word may there is an important word because we don't really know. There wasn't many studies and they were of low quality. So again, more research is really needed into this. So what we did something about that. I adapted a website known as Exercise Guide. It's been used in Canada called Exercise Guide Canada and Australia, Exercise Guide Australia. I very cleverly named it Exercise Guide UK. And what we've done is we developed a website, adapted the website, sorry, developed new content with patients with lung cancer because I think it's critical that we involve patients with lung cancer in the development of our research. As someone who doesn't have lung cancer, I don't know the day-to-day struggles and things that are important to the individual with lung cancer. So it's imperative that we co-design these things, I think. And if anyone's interested in helping kind of design studies in the future, please let me know. So again, what we did was we found the feasibility, and that means really, does it work? Can we prescribe exercise and education through websites? Acceptability, do you like it? Early evidence is that I haven't analyzed everything, but it is seeming pretty good. That's not just because I made it, but it does seem to be working for some, for a large portion, and people tend to like it. So just to finish off, I just want to say thank you to some people who've helped me throughout this project and the people who funded me to do this project. That's some references. Any questions? Whew. Any questions? Help with it? Yeah, so there's constipation obviously can cause a lot of stomach pain. And as far as I'm aware, I don't know much about the process of helping constipation. So that's something that I can't really confidently answer. To be quite honest, I would hate to give you something that I don't really know the answer to. Yeah. Yeah. I can bet. Anecdotally, I could say it does help, but I've got no evidence to back that up at this point. Yeah. I did mention them briefly. So, any other questions? Yeah?
I read somewhere that in most of cancer people are less muscle level, and having a muscle is very important because of the keeping the body temperature warm and lots of fighting with the cells and so on. So my problem is I don't have enough muscles, and I like to build the muscles, and I play tennis, but probably not enough. But my struggling is it's very difficult to find the right exercise and discipline myself. I don't know what is I know this exercise is good, but I don't know how to build the muscles.
Yeah, so it's a very good question. To not get out of it, but it's always speak to a professional because we tailor everything to you. My practice is I always ask individuals what their goals are, what they want to do, and then we do an assessment at what we call baselines right at the start to see where you are. And some of the exercises that I showed before are some great kind of foundation exercises. So I get a lot of people doing the adverts of TVs to just start doing some sit to stands. Like I said, when you're making a cup of tea, do a bit of walking around the house. So if you're looking at things like muscle loss, which is quite common within cancer, these kind of foundational things that you can do, you don't need a gym, you don't need any equipment, you can do in the house, can be really useful to start building muscle. And as you start building muscle, these exercises will become easier, then we'll progress them some more. But it's difficult to kind of we can't give a blanket kind of, you need to do this, this, and this, because everything's individualized. If someone's got metastases, again, we tailor the exercises to that. So it's a bit difficult. I hope that answers the question. But yeah, it can be done very simplistic to start with, and then you can progress up from there.
So in that case, it's better to just have some advice from those professional, like personal trainer like you are.
Yeah, because when we're looking at kind of prescribing exercise, there's a lot of things that can go wrong. You can get adverse events. So it's really important to speak to someone who kind of knows about this. And clinicians often will be able to point you in directions of kind of people like physios or physiologists. So if you've got some questions, speak to your clinician first, or your CNSs, because they can help you point people in the right direction.
Okay, thank you.
Thank you. I just wanted to ask a question about alectinib in particular. I don't think it applies to the other TKIs, but it might. So when you take alectinib, your liver function is severely affected, your CK often goes up, and that, I'm not sure if your CK goes up because your liver is affected or because you get breakdown within the muscles, but certainly one of the side effects is that your long muscles in particular are severely affected, in my experience, on alectinib. So the long muscles, particularly in my legs and arms and my back, have been severely affected, which means I can't do very specific things like walk up hills, do my hair. Very important. This, for me, has got better over time, and certainly with an increase in fluid. But how should you push yourself to exercise? So I could walk for 5 miles on the flat, no pain, absolutely fine. Or I can walk for 20 seconds uphill and being crippling ugly at the top. So what should I do? Should I persist in exercising my long muscles or not?
So what was important when you mentioned there is that walking uphill puts you in pain. Walking on flat ground doesn't. So you could walk quite a way, probably on flat ground, without much pain. You may get breathless at times, but again, there's no real pain there. If there's no pain, that's good. If you're walking uphill and you're in pain and you're thinking, this is awful, I don't want to do this anymore, stop. walk on flat ground. You get some great benefits from just walking. I think with the fluid as well, moving can help that kind of distribution of fluid. So we see in breast cancer a lot of kind of lymphedema, and it can help kind of get it around the body a bit easier, and it can reduce the severity. But in terms of things like doing hair, I don't prescribe that as an exercise, but exercises that we do, like the bicep curls, and we also do things like overhead presses, where we get you to sit down to start with and just kind of slowly raise your arms above your head, kind of 3 or 4 times. And at the start, getting just the movement, no weight at all, just with your arms, just getting them moving. And then we add a little bit of weight if it's appropriate. Some people just do that for 3 or 4 weeks, and that's a good enough starting point. So to answer the question, you should never really be thinking that you're in pain. I mean, exercise isn't comfortable often. The way I put it, you should be comfortably uncomfortable. But walking uphill in your real pain, I would recommend just walking on a flat ground. And keep going and go for a good time. To answer the question.
Kind of. I think that also it isn't all the time. So if you can walk uphill, walk uphill. If you can walk uphill slowly rather than pushing it to keep up with your dog. Which is what happens for me. And to keep persisting, to not think, well, I can't walk uphill, so I'm not going to do that anymore, because you might be able to next week.
I think that's really important. Walking on the flat ground when you are feeling the pain, and trying it, walking up the hills when you're feeling able to. There is benefits of walking uphill. Obviously, it engages more kind of the calf muscles, and kind of you'll probably feel it when you're walking up, but you feel a bit more of a sweat going on. So trying it, but if you're in sustained pain, don't try it. Don't keep doing it, sorry. But if you're able to, definitely try it. And I guess, like I said, auto-regulate. Listen to your body. You're the master of your body. You know it better than anyone. So listen to what your body is telling you. So, yeah.
This is related to that. I found the flat, no problem for hours I can walk, but hill, even 20 seconds is short of breath. I'm very tired.
Yep.
But no pain, just no pain. But it's climbing up the hills, the mountains. I was surprised how short time I can do out of, without the out of breath. It is because my electronic or cancer, or in that case, should I just have a rest, or should I push forward because I don't have any pain?
If you're feeling breathless, do you have a fan at all that you use? Because fans are a great way of kind of helping cool down the nerves around the mouth and kind of helping you reduce that level of breathlessness. There is also some breathlessness techniques that you can do while walking. For example, if you're starting to feel getting breathless, you can do pursed lips breathing or diaphragmatic breathing. So the diaphragm is a really important muscle in helping you breathe. So if you're starting to feel breathlessness, just have a little stop. Don't push through it because you can make it worse. Have a stop, get control of it, and then you can keep going if you're able to. But yeah, there's some techniques that we can kind of teach in addition to exercise that would help reduce, because exercise can cause breathlessness, like it increases heart rate and the amount of oxygen we need. So being aware of that is really important. There's a few kind of factors, but we see it across a lot of cancers, specifically in just all lung cancer, a lot of lung cancers, sorry. So it's not just the alectinib. We see it in a lot of other lung cancers as well. Yep. Which, yeah. So, yeah. So the Braddock. Yeah. No. Yeah. So when you become more active, yeah, when you start doing activity, your heart rate will increase. If you've got bradycardia, the muscles aren't getting the required blood flow and oxygen to help kind of continue doing that exercise. So after a few minutes, it will kind of, your body will readjust. Yeah. Yeah. Yeah, exactly. Question?
Hi, quite similar to what we've been saying. My experience is that I can swim quite easily, I can cycle on flat and walk really easily, but going up the stairs at home, I'm breathless by the time I've got to the top of the stairs, and I feel like an ancient old woman. And so, you know, if I'm in the pool, I feel, well, great, I feel really healthy. But walking up the stairs at home, which I do a million times a day, I'm just exhausted. And I guess it's that same question about how much do you push yourself, you know, because I feel it's putting my heart under strain. So I'm trying to do, you know, walking and swimming because that it feels much better for me at the moment, and it's not so exhausting. But at the same time, every time I go upstairs, I just I feel really unfit, and that doesn't feel great.
Yeah.
So, but I'm not sure why I can do some things but not others. I don't know if you've got any suggestions or advice.
It could come down to the specific actions or movements that you are doing. A lot of people who I find that struggle walking upstairs, we do this exercise in particular because it helps train them leg muscles. But in that same vein, cycling and swimming also does. So I think with stairs, there's no real right or wrong answer, to be honest, with stairs. And a lot of people will have this impact with stairs, and they struggle to get up and down stairs. But from the evidence that we see, that particularly these exercises like the calf raises, the sit to stands can help because they mimic the motion. And stairs aren't the same movement pattern as kind of cycling. You're really pushing up, and that takes a lot of effort to get up. I don't know how you found the sit to stands just before. If you did them or not, I did do it.
Probably cheated them, but
yeah.
no, it was okay. I think I managed it, but yeah, I will try doing that. I thought that was a useful one to keep trying.
Great. Is there any more questions? Yeah. Hmm? Hmm? Yeah. So if you're looking at blood circulation, things like the calf raises is great, but neuropathy comes down to the nerves, and the nerves is quite a hard one with peripheral neuropathy. The evidence isn't great on neuropathy, but if you've got peripheral neuropathy and you're struggling to do exercise, there's certain things that we can talk about to help exercise be a bit easier for you, which we're going to talk about a bit after because it's very tailored. But things, the general things like if you're doing the sit to stand and you've got neuropathy, you may have a bit of a balance problem. I don't know how your balance is in particular. Yeah. But it's the pain. Yeah. Things like walking kind of consistently on your feet, you can get shoes, things, but cycling is also another great one. I don't know how, if you cycle much. That's another great option, is kind of just coming off your feet a little bit and giving them that chance to not have that constant walking, I suppose. But if you've got any balance issues, again, what I've seen before patients do is they take the shoes off so they can really kind of feel the floor. They can feel where the nerves are on the feet. They can feel where they are. They can balance yourself. Take a bit of a wider stance, helps you situate yourself. If you're doing a sit to stand, you don't need to put your feet right together. Shoulder width apart, nice kind of steady base. So they are kind of techniques you can help with the balance side of it, but with the pain side, it's very difficult because like I say, it's the nerve. So sorry about that.